are an agency based in Dallas, Texas, and we are a full service agency. We also have an egg donation agency, Simple Donations, which we kind of partner on the side with. And I don't know, what else do you want to say?
How many of you here today know anything about surrogacy? Are you kind of just in the initial stages of getting information, or have you done your research? A little bit of both? Okay. Well, being in Dallas, we have a couple of advantages. Matching people in Dallas. A lot of our intended fathers from New York are matched there. We are getting pre-birth orders. This is our attorney, Lauren Duffer. She was the first attorney to get us a pre-birth order for 2 intended fathers in the state of Texas. So now we've got a couple of different judges that she's getting it with. Basically, a pre-birth order allows the biological father to go directly on the birth certificate, which you don't get in a whole lot of different, just numerous states you can do it in, but
we've got a couple of advantages being in Texas. Texas has super great laws for surrogacy. Believe it or not, great for gay surrogacy as well.
Wendy Davis.
Yes. Yeah, so we've got some great laws there. Lauren is able to get the contracts validated, and Texas has great laws, which means the validation applies to you guys. So that means the contract is enforceable in a court of law. That is a great thing because that is not the case in most states. A couple other advantages in Texas is it is way cheaper to live there. If you guys want to save a lot of money, go buy a house in Texas. It's kind of a big commute to your jobs here in New York, but that's another reason we can pass on those savings to you guys. We also don't have a state income tax. So a lot of people wonder how we can charge so much less than other agencies that offer the same services, and those are the reasons why. We've got a lot of advantages being there.
If you look on menhavingbabies.org, you'll be able to review ratings by former intended parents on just about every agency in the country right now. Right now we're rated pretty highly on there. We're also the least expensive surrogacy agency in the United States, and we've been in business longer than a lot of them. We do offer a lot more services under our program fee. We don't charge you on top of it, like psychological evaluations, criminal background checks, insurance reviews on our surrogates, and so on. So really when you get into this process, you really kind of want to look at all the different agencies that are out there, see which one works best for you. Maybe you don't need as much hand-holding as the next. There are some agencies out there that just match you and kind of send you on your way. But there's agencies like us that really guide you the entire way. We do everything from making sure your surrogate goes to her appointments, making sure that she's keeping in contact with you, letting you know when her appointments are. You have your own intended parent coordinator through our program, one person that you can call and basically tell everything to and ask questions to. You don't have to talk to 12, 15 different people through our program.
You're going to have our phone numbers too. So
yes.
If there's a question about finances or contracts, you call me, I pick up the phone and I talk to you and I'll walk you through whatever questions you have. And Stephanie manages the whole other program with the surrogates and coordination that. So if you have an issue, she answers the phone at midnight. Like she'll say, I was on the phone last night with such and such, all the way till midnight. She goes to the births and handles the whole process. So as you can see from Michael and Danielle up there, we're pretty hands-on agency. That's what we kind of offer to people is we're the main 2 owners, although we do have other staff you're going to talk to and work with. If there's ever a major issue or anything that's going on,
we're there.
We're there at all the time.
We are, it says on our website, we are open 7 days a week, 365 days a year. Now, while we hope our intended parents won't call us at 2 o'clock in the morning with just a small little question, I am available. I always answer my phone, and the surrogates know that. One of the reasons that we do have a lot of surrogates in our program is, we take care of them. We support them throughout the whole process. We make sure that they're getting what they need from their intended parents. If the surrogate doesn't hear from you for 2 weeks and she's feeling upset about it, well, believe me, I'm going to call you. And I'm going to go, we have a problem. Same as if you call me about your surrogate and go, hey, I didn't hear from her. She didn't call me at her doctor's appointment. I'm going to be there to go, hey, you need to go by your contract. This is expected of you. And these are things that we go over with them from the very beginning.
We try to take all of that things in the process that can be bumps in the road and try to help you smooth them over. So if there's communication issues, we're there to kind of step in the middle. You don't ever have to talk about money with your surrogate. If there's an issue with that, we will do that. We can be the bad guys or the good guys. I'm bad cop, she's good cop. We've had to do that, several times with people throughout the policy, but that's that's what we're here for. We're here to make the process so that you guys can enjoy being pregnant as much as possible. We want you to enjoy the pregnancy, go to the doctor's appointments, and really like your surrogate and get to know her and be friends and family, and leave the rest of the, you know.
And we want you to come back.
Yeah.
You know, that's another thing. A lot of our intended fathers that have been through our program have been through our program more than once. I mean, if you read the reviews on Men Having Babies, we've got parents who have done 3 and 4 journeys with us, you know.
And we want you to come back and let us
big
hold the
families. You know, and the same thing with the surrogates. You know, if I have a surrogate that leaves my program and she's unhappy, she's not going to come back and do another, you know, another journey with us, and she's certainly not going to refer her friends. And that's another thing. You know, most of my intended fathers, I mean, I have numerous ones walking around here tonight that have referred 5, 6, 7 friends of theirs, you know. So, I mean, I definitely want to make sure that the journey goes well, because if it doesn't, I get a bad review on Men Having Babies. I don't get a referral, you know.
And we don't get to hold the babies.
Exactly. I mean, I went to, if you're on Facebook, you can friend request us on there. We have, you know, updates a lot. We've got a private Facebook group for our intended fathers. They go on there and share information about their surrogates and their babies that are born, and, you know, ultrasound pictures and so on. But if you look on there right now, I went to 5 out of 7 births that we had this last week within 3 days. You know, so we had actually 2 intended fathers from Texas, or from New York, deliver in Texas. So I got to be there for those births and made sure that, you know, that their legal paperwork was taken care of with the hospital, that they got to a room with their own baby. You know, they didn't have to leave the hospital and leave their baby there, that their surrogate was taken care of, and, you know, and everybody gets to go home and be happy. So
we're there for that entire process.
Yes.
Does anyone have any questions for us?
Do all of your surrogates live in Texas?
No.
No.
As a matter of fact, one of our surrogates that was, I don't know if you saw her rocking a baby next to the panel. She's actually from Pennsylvania.
She's matched with one of our GPAP.
Yep. Intended fathers that are here tonight. We have
any
surrogates.
state that it's legal in.
Yeah, we have a surrogate in.
Yep.
So I've been hearing that some of the costs can be mitigated if you use the IVF clinic is also the one responsible for the locating the egg donor. There might be some cost savings in
It depends on the clinic.
clinic actually be part of that process versus that would be part of what your services as well.
Well, our primary area of service is surrogates
surrogacy.
and matching the surrogates. We do also have simple donations, which you can find an egg donor through, and we can coordinate the clinics. But yes, many clinics that we work with have their own pool of pre-screened donors or have a donor bank. And we've had some of our surrogates actually, some of our donors actually go be banked egg donors with them. And again, I think they touched on it a little bit this morning, but it depends on how many embryos you're going to need to try. If you're both going to split the number of embryos and cycle that way, then you're probably going to need a fresh egg donor. So in that case, a donor bank at a clinic might not be the best option for you.
Yeah,
But
because
if
they
only
only
one
have
of you is
so
gonna
many.
contribute. Right.
So, you know, if you're going with a frozen egg bank, you need to make sure that this donor is going to be available again if you need her. You know, let's say you go through the batch of eggs that they give you and nothing works. You want to make sure that they've got more, or she's going to be able to cycle again, which, nobody can really ever guarantee you. But, you know, if you wanted to have a sibling down the road or something like that, you want to at least hope that she's
But
available.
that's certainly an option if you wanted to look into. Most of the clinics we work with do have pre-screened donors that have been through them before, or like a bank of donor eggs, and those are frozen donor eggs.
Do you work with any clinic or like the one that
Yeah, we work with any clinic. We work with basically any clinic, but we do have preferred clinics that
We
we
do.
work really closely with, like Las Vegas Fertility, Connecticut Fertility, Fort Worth Fertility, and we've got really good working relationships with all of those. But we work with basically every clinic. All over the country.
We like to stick with what works. You know, we have a lot of intended parents that come to us that need guidance on who to choose as far as the clinic goes.
Right, and you might come in with your own clinic that we will work with them,
But we're going to tell you our
we're gonna
personal
tell you
opinion
our
on
personal
it too.
opinion of whether they're going to have great success rates or not, because we do have people who come in with a clinic that we have seen fail before and we've had trouble with, and we're going to be honest and say,
Because it makes our job
Right.
harder.
Exactly.
Our whole goal is get them matched right now, get them pregnant. As soon as that happens, our job is easy.
So we want
You
you to have a
know,
baby fast.
there are a lot of clinics out there that charge a lot more than what our average cost is as a whole. You know, so like right now in Men Having Babies, I think we're rated at $90,000 total in and out. Now that's because the majority of the intended parents who filled out those forms actually
through
let
clinics that we
us
refer to.
refer them,
Yeah.
you know.
'Cause
So
that
if you're,
cost goes up if you're choosing a clinic
Because that
that's
was the question I had
substantially more
earlier in the
expensive.
session was, like, they said, choose your IVF, choose your agency. We are kind of
choose your
saying,
agency
Choose
first.
your
choose
agency first.
Yeah, because your
Yeah.
agency is going to, I mean, they're going to be able to tell you, I mean, at least a reputable agency who's been around long enough is going to be able to tell you who they've worked with, who has worked, you know,
Success rates.
their success rates and so on. And it's not just that. I mean, a lot of intended parents, you know, think, well, if I go on SART and I look up, you know, their success rates there, that you're going to get the full story. It is not the case. I mean, some clinics, you lose paperwork. They don't have good bedside manners. You know, there's always something that we can tell you about
And
a
some
clinic.
of them aren't used to really working with surrogates.
Exactly.
A lot of them have only worked with intended parent couples.
Or
It's
some
a
of them
whole
are
different
gay
thing.
friendly, not
Yeah.
gay friendly, you know,
Exactly.
so.
Yeah.
I don't know if we have time, but could you quickly walk us through your matching process? Or
I can.
Anything that you think is, because we're going to hear a lot about those, I think.
So,
like anything specific, like
yes.
unique about yours versus.
Yep.
When an intended parent comes to my program, I'm looking to match more on personality than anything. I want this to be somebody that you can go, hey, I trust her. You know, I don't want you calling my surrogates and going, did you have caffeine today? You know, how many cups of coffee did you have? You know, and worry about whether she's smoking or doing drugs. You know, these are really good women, but at the same time, you don't know them when you first, you know, get a profile. You need to kind of build a rapport with them and be able to trust them. So we send out the profile, your profile, to a surrogate. I'm basing it on stances on selective reduction, stances on termination, how much contact you want during the process, how much they want. You know, I'm kind of matching those up, and then I send your profile out to the surrogate mother to review. Now the surrogate will review it. If she has a husband, he'll review it, and then they'll both get back to me and say, hey, yes, we like this couple, or no, this isn't the couple for us.
And then if you like each other, then you get to have a phone call.
Right.
Supervised phone call.
Yes. Well, you would get her profile at that point, and then, yes, you would get her full profile. It's usually about 25 pages long. It goes over everything from their medical history to their education. If they've ever been a surrogate, it'll go over how many attempts their first surrogacy took to become pregnant, what their first beta numbers were, what they disliked, what they liked about their surrogacy. It's going to go over their family profile. Does their husband work? Do they work? What hours they work?
Pictures of their house. Pictures of
Yes,
their children.
inside and outside of their home. You know, I mean, these women, I know there's a lot of people who think that these women are being taken advantage of. It's not the case. Most of my surrogates are very well educated. These women make a good deal of money. They can support their families, you know. We don't take women who are on financial assistance, food stamps, you know, stuff like that. So these women we know can support themselves without the use of their compensation.
And they all have an interview with Stephanie, who, as a 3-time experienced surrogate, knows what it takes to be a good surrogate. So nobody gets through a program that has not been really thoroughly screened.
Yes.
Is part of the screening process is that they have health insurance that
Yes.
cover the, okay.
Correct. If they don't have health insurance when they first apply with me, I help them get health insurance. Whether it's applying through the ACA or, you know, just picking it up. I mean, I have surrogates who are like, well, I didn't think to pick it up at work, you know. So, you know, we help them with that process. But yeah,
90% have health insurance, and if they don't, we can help them get it through the ACA so that their pregnancy is covered.
but even that's, you know, done before they start matching. So part of the matching process also, I mean, screening, you know, psychological evaluations. Our
Background checks.
psychologist is actually
Credit checks.
former intended father himself. Him and his partner had 2 children through our program. So he himself kind of screens them and goes, you know, would this, you know, be somebody that I want to carry my child, or, you know, so it's good to have that. Go ahead.
Does he travel all over the country then? 'Cause you,
It's mostly by phone.